Chrissy B.
And I'm Dr. Rob Hicks.
And today we are bringing you a medical special, and we'll be covering 4 different areas that are very common but not talked about enough. Now, Rob, which 4 areas are we going to be talking about?
Well, we're going to start off with cervical screening, cervical smear test, very important for picking up abnormalities and treating them before they can become cervical cancer. We're also going to be dealing with the skin condition psoriasis, surrounded by myths, and we're going to get rid of all those myths. Another skin condition, rosacea, which many people who know people who've got rosacea sometimes think, is it because they're drinking too much alcohol because of the symptoms, but they're not. And last but not least, heart disease. Many people know that it affects men. Many people don't know that it affects women too. Okay, so lots to get through. Well, this show is all about mental health and well-being, and there is of course a link between a person's physical and mental health, isn't there? Absolutely right. Everything physical impacts on us emotionally. Things in our emotions and our mental health impact us physically. So we should never separate the two, always address them both at the same time. Okay, so let's tell everybody who we've got on as guests today. Well, we have, as I said, we have a very packed show. We have expert gynecologist Mr. Julian Brady, who'll be advising the ladies out there all about cervical health and what to look out for. And we also have Eliza Flynn, who found that she had abnormal cells after a smear test. We also have consultant dermatologist Dr. Anton Alexandrov, who will be telling us all about rosacea, and Sarah Jagger will be telling us how rosacea affected her life and what she's doing about it. And we also have Sonia Roseman on to talk about living with psoriasis. And of course, Rob, we're going to be having you on throughout today's programme to give your expert opinion as well. All right, guys, so let's meet our first guest, Mr. Julian Brady and Eliza Flynn. Welcome to the show, Julian and Eliza. Lovely to have you here. And Rob's going to be giving us his expert opinion as well throughout the show, the whole show actually. So Eliza, let's start with you. So you had, you were quite reluctant to go for smear tests in your 20s. Can you tell us about that?
I just didn't feel like it was the most fun way to spend my time, to be perfectly honest. And I guess no one ever likes doing it. So it was something I was always dreaded, getting the little bit of paper that said, time to book your appointment.
So did you still go, or were there times when you just missed it completely?
Yes, I still went. I still did. I think it's one of those things where I think you might as well. No matter how horrible it is. So that was my attitude towards it. But then was one particular smear test that came back as abnormal. Can you tell us about that? Yeah. So prompted by something in the news about Jade Goody, I decided that I should go for a smear test, so I went to the doctors and asked to book it in, and they actually told me I was too early. So I thought, okay, came in sort of early 2013, and they said, oh, you know, we just need to send you for a colposcopy. Didn't actually tell me anything was wrong, so I thought it was maybe a routine check, that they had to do it again because they couldn't get enough cells. And when I went for the colposcopy, they did a whole bunch of tests, including a biopsy. And the nurse there said, it looks like you have abnormal cells. And so that's when I realised, okay, this isn't quite a normal procedure as what I thought it would be. And everything came back, and I was diagnosed with something called CIN3. And they said that the next thing we need to look at is what's known as a loop diathermy, which is apparently when they've got a little loop that gets heated up and it scrapes off all the top cells of the cervix.
And obviously the two of you know what she's talking about.
That's my day job. So
Now, Julian, just before Eliza carries on with her story, so these abnormal cells that she's speaking about, can they be prevented, or is it something that just will happen to anyone, any female?
It's very difficult to predict who will get the abnormal cells, because the way in which abnormal cells develop, all of us, once we're sexually active, we're exposed to a virus called the human papillomavirus, and it's a normal part of everybody's life. Between 8 and 9 out of 10 people will be exposed to it at some point in their life. And most people, you get exposed to it, you clear it, but some people for some reason don't clear the virus and it goes on to cause these abnormal cells. So the whole point of going for your smear test is so we can identify the abnormal cells before they've turned into cancer cells.
Okay.
So you treat them at a precancerous stage like yours. And I suppose that's the most important thing for us from the screening point of view, is actually making sure that women do go for their screening test.
Okay.
You said you could think of better ways of spending your day, and I think that's the tricky thing for us in the screening programme, is we do realise it's an incredibly intimate examination. A lot of women are quite rightly very anxious about having it done, and as a consequence, sadly, an awful lot of women don't have it done. So we're trying to think of different novel ways of trying to engage women getting back into screening, because if you...
What kind of engaging ways are they? It's just out of interest.
I think it's just, I mean, just to put it into perspective, there are 1 million women in the UK who've never had a smear test, ever.
Really?
They've never, ever been.
That's shocking.
And there are 1 million women who are late every year. So although we think it's a good system, it's clearly not a perfect system, because you've got 1 million women who've never gone.
Wow.
So, and that's for a variety of different reasons. Gynae Health UK, who I work for, we've done some research trying to find out why women don't go for it. And anxiety is about 1 in 4 women. A previous bad experience is about 1 in 4 women as well. So most women will give you, I mean, you know, for your sort of female, members of the audience, and sort of, you know, I mean, it's a pretty unpleasant piece of equipment that needs to be used. You know, your cervix sits in a very, very intimate place, so actually trying to get to it. So we've tried to think of different ways to try and make that easier for all those women who are anxious. And there are certain very excluded groups of women, so ethnic minorities, the gay and lesbian community, and especially those women who sadly have been the subject of sexual violence. I mean, they find it very, very difficult, as you would expect, to go for smear tests. So we've tried many different things, text reminders, trying to make the clinics, you know, Rob will tell you, in primary care, you try and make it as open and as engaging as you possibly can. But I suppose our sort of nattiest device is the use of something called Gynae Check, which gets ladies to do the first bit at home. So what
well, that looks more pleasant.
I think it is more pleasant. So what it effectively does is it splits...
Or less unpleasant, I should say.
Unpleasant.
Yeah, probably that's a better way.
It splits the screening process into a 2-stage process. So you test yourself in the comfort and privacy of your own home, on your own, by yourself. This test if you've got the virus. If you do have the virus, then I'm afraid you do have to go for the traditional old-fashioned test.
So if you use that first and you find that everything's okay, then you don't need to go for it?
You don't need to go for that ever again. So you could theoretically never need one of those ever again.
Oh wow, that would be amazing.
Okay. So that's the benefit
Rob,
of this.
what do you think of that?
I think it's a very innovative step forward, because the issue is we know the screening programme works provided women take part in it. And as Julian highlighted, this is about identifying abnormalities before they can become cancer and treating those abnormalities. And many women are not aware of that. And I think whatever methods we can use to encourage women, you know, should be supported. And it might be simply, if it's your first smear test, what we say to our patients is, well, come in and have a chat with the nurse first. Meet the instrument, see what's going to happen, and then you can come back and have your smear test.
I think it's about trying to break down the barriers, because there's an awful lot of urban myths about how awful it is, and it's actually really, really important, and it's an almost preventable disease. If you go for your smear test regularly, you will not die from cervical cancer. It's almost as simple as that. So it's for us, it's really, really important about just trying to give whatever woman, for whatever reason, she's not been confident enough to be able to do that. This is all about empowerment of women and having the choice to actually say, well, actually, I'll choose to do it that way. I wish I could give it to people on the NHS, but not quite yet.
Not yet.
So.
One day.
Well, actually, importantly, what we're trying to do, so we launched something called Target 100,000. So can we re-engage just 10% of that women who've never been for a test? Can we just engage 10% of them to go again? If that happens to be with this device or just raising the general awareness, then that's fantastic. If we could just get them, if that just gives them that first step to get into the system, then that's brilliant. If you're comfortable with the old-fashioned system, then stick with it.
Yeah, some people don't mind, do they? Now, Liza, how glad are you that you went for your smear test after everything that you went through?
So glad. It's something that I have never, ever regretted. And it's something that I constantly tell friends. because I speak quite openly about it to my friends, and a lot of them are going, oh, I really should go and get my smear test done. And for them, it's been, say, 5 years.
Even after they've heard about your story?
Well, I think it's hearing my story that has prompted them to do it.
Okay.
But a lot of them, it's just so hard because you have to get an appointment within, you know, you've got to try and sort out your work schedule. For some people, it just takes a long time to get there. A general appointment for a smear test, I found, can take sort of an hour because you've got to travel to where you're going to, you have to wait for the appointment. It does take a long time, so I can see why people are put off it. But you can't buy health. That's one of the things that I've realised. So it's fundamental that everyone does go.
And you might not have even been here if you didn't go for that test.
It's horrible, actually, when you first get a diagnosis and you don't think anything's going to be wrong with you, and something comes back and immediately you fast forward in your head to what is your future going to be like. I mean, I ended up having 2 operations in the end, but it could have been more if they hadn't caught it at the right time. So I'm very grateful for that.
Did it change your outlook on life at all?
It made me think of all the things I wanted to do. And it absolutely made me realise that I had to get my friends to go. But also it makes you realise all the things that you enjoy. And it's quite a terrifying time because you think of all the things that you want to do that you've still not done. And so I'm trying to do them all now.
Well, I think it's great that you've actually come on to talk about that today, because I'm sure that's going to prompt many women to go for their smear tests.
I hope
definitely. Yeah. Right,
and gynae-check is actually quite a pretty easy thing to do. I've already tried it.
Oh, have you?
Yeah, I've tried it. I've tried it, and it really does take 5 minutes.
Wow. Okay. That's really good. Rob, any final words? Any bits of
I would just follow
like?
on from what Eliza says about, you know, it's not just general practice where you can have your smear test done. I work in a sexual health clinic, and you know, women are coming to be screened for sexually transmitted infections, and we're able to do a smear test at the same time. So many women feel it's less intrusive because they're having swabs taken anyway. The other thing is, in many sexual health clinics, you have a walk-in service. So you can come in at any time and say, right, I need my smear test doing, and it can happen that way. But I would say, you know, always have it done. Bring a friend with you, and if you want to be distracted during the procedure, use your smartphone.
Yeah, you like to do that. Mind you, it really depends, because you know sometimes it depends on who's doing the smear test as well. Because there's some that I've been to, one in particular, the person just didn't stop talking, so I didn't even have time to think about anything. I was answering all these questions. I know it's a tactic.
I think if you're very open about your anxiety about it, most people who take smear tests are very aware how difficult it is for most people, and they really will try everything to put you at your ease so they can get the appropriate test.
Yeah. All right, guys, thank you so much for coming and talking about this. I'm sure we put many people at ease, and like there'll be lots of people, appointments being made now for smear tests. Thank you, Eliza.
Thank you.
All right, guys, Rob, you're going to stay with us, aren't you? Of course, because after the break, we'll be speaking all about the skin condition psoriasis with our real-life story guest, Sonia Roseman. Hi, I'm Chrissy B, and my show is all about improving your mental health and being happy. Join me every Monday, Wednesday and Friday at 10 p.m. on my channel Sky 203. Visit chrissybshow.tv for more information and subscribe to our YouTube channel, Chrissy B Show. You can also follow us on Twitter and Instagram at Chrissy B Show, and on our Facebook page, The Chrissy B Show. Welcome back everyone to our medical special, and I'm still here with Dr. Rob Hicks, and I'm also now joined by Sonia Roseman, and we are going to be speaking all about psoriasis in this segment. Welcome to the show. How are you doing?
Yeah, not bad.
Thanks so much for coming on to share your story, because I know you've been through some really difficult times.
Yeah, second time now. Thank you for inviting me back on again.
Yeah, you did. Sonia was on before. She spoke about something completely different, but I remembered about this as well, so you know, I thought it would be good to invite you back on because you were so lovely last time. Cheers. So Rob, you're going to be obviously giving us your expert opinion about this and giving us the facts and everything. So let's start with you. What is psoriasis and how does it develop?
Well, psoriasis is a long-term skin condition where, for some reason, the immune system in the body triggers the cells to replace themselves far more quickly than they would do normally. So normally skin cells replace themselves over a matter of 3 or 4 weeks. With psoriasis, the cells replace themselves over a matter of days. and that causes the cells to build up, and you get the red, itchy patches on the skin, which is not just a physical issue for people. I mean, it has a very emotional issue as well, but primarily because of the way the skin appears, but also because of the way other people react to somebody who's got psoriasis. There are a lot of myths around psoriasis, so let's get those out of the way. One, it's not contagious, and it's not because somebody's done wrong. And the one thing you can do to help somebody with psoriasis is not stare.
Okay. Yeah. All right. But what is there anything in particular that causes it? Can stress bring it on or anything like that?
Well, nobody knows exactly what kicks it off, but certainly flare-ups of psoriasis can be triggered by stress, they can be triggered by infection, they can be triggered by injury. So when we're looking after people with psoriasis, we try and encourage them to identify what sort of triggers might set their psoriasis off, and to avoid those as best as possible, along with, of course, the treatments, the creams, the ointments, and sometimes the ultraviolet light therapy as well.
Okay, all right. So let's speak to Sonia now. So tell us, when did you first notice change in your skin?
Well, the first time that I got it, I must have been about 12, and it was literally at the back of my leg, and it's something that tends to be in the family. But that was then, and it went away after a little while. And this time, literally 3 years ago, my dad passed away in Thailand, and we don't really know what killed him or how, but we know it was all the Thai police. It was a big cover-up, and for instance, he would go travelling for 6 months at a time, and he was quite a rich man, you know, so he always had money in his wallet, and he had great cameras and stuff like that. And when his stuff actually came back, along with his body, we actually had him repatriated, there was hardly anything in his suitcase. So I was out there for my birthday. This was in the October of 2012. He died on January the 11th of 2013. So he would have had all of these pictures, and he was a bit of a party animal, you know. He was 72, but something was very amiss about it all, and we couldn't get to the bottom of it at all.
Is that when you started to get really stressed out? And like,
you know, because I don't know what killed my dad. So it almost is like a robbery or something like that. But it's all very corrupt over there, which I knew anyway, because he used to go into, it's a place called Pattaya. There's lots of go-go bars, things like that. You know, it was an absolute party animal. But still, whenever you lose a parent, it's painful anyway, but we will never know what happened, me and my younger brother and sister. So it was awful. So I had
Is that when did things flare up then? Did the psoriasis get worse at that point?
Yeah. And I suffer from ulcerative colitis, which apparently has something to do with the immune system that you were saying as well. It's all the same thing, and the stress just brought that out. And a year or so later, my long-term, you know, literally the love of my life, we kept arguing, so I was so miserable all the time, and I couldn't cheer up. And he said, that's it, I just can't do this anymore. And I couldn't believe it. And that's when it went, well, I just became covered in it. And it was awful. And I kept going to the doctors, and they said, no, you know, you'll be fine, you know, fobbed me off with a bit of cream. And I said, look, I really need to go to the hospital. I said, it is absolutely everywhere.
And what did it feel like? Was it burning? Was it itchy?
It bleeds, and it got to a point where I would have to hoover my bed in the morning. And in my scalp, you know, as well. I mean, I've got a piece on today. My hair hasn't grown through like it should have done, which as a woman, I'm quite a feminine woman. I like to wear old retro stuff, you know, like 1950s and 60s clothes. I can't even wear a miniskirt or a dress. So obviously, I did actually go to hospital. I had 7 weeks of treatment, light treatment, and you go and have a bath and all of that. It did go away. And literally 2 weeks...
Went away completely when you had that?
Yeah.
Okay.
And literally 2 weeks later, it started to come back again. So it's back on my legs, you know, I've got a bit on my arm there. And I just hate the point, you know, you can feel somebody staring at you, especially women. It's always women, because I don't know why. And I think, oh, don't stare at me. And I'd even, if I was in a queue somewhere, I'd put a hat on in case someone's like staring at my scalp, my head. So it's made me really paranoid anyway.
Which is what goes back to what you're saying, like, when don't stare. But I suppose it's because people don't know, like, sometimes out of ignorance, isn't it? You just see something that you're not used to seeing and you stay. But that's obviously why we do shows like this, is to raise the awareness, to help in all sorts of things.
Yeah.
Yeah, I mean, as you say, it's often, the condition is made doubly hard to look after because of the way other people react. And psoriasis, particularly when you get in the scalp, will cause an awful lot of flakes on the shoulders. So people will keep saying, oh, you've got bad dandruff, or I'll give you a treat. I know a good shampoo for that. But actually, it's not a dandruff you've got. You've got a significant skin condition, and the emotional side of it is it will isolate people. They won't go out, and it's actually it drives them. The stress makes it worse. They stay at home. They won't go out. They get depressed, and it just drives this vicious cycle. So if anyone can sort of learn a bit more about psoriasis and be a bit more sensitive to those who've got skin conditions, it will be a huge bonus for the millions of people who have skin conditions in the UK.
Has it stopped you from sort of going out and things, or would you say you're kind of?
It did do when it was terrible, when it was literally all over. But I just wish that, it sounds so funny really, that most women want to be skinny or taller or something like that. And I will look at somebody over there, if I'm out somewhere in a bar, and I'll go, my God, look at her skin, it's beautiful, because it's nice and clear. And it upsets me so much, honestly, it's awful. That's the thing, because it does something inside as well. And you're trying to get better, so I've been going on loads of bloody sunbeds, literally. But it's not good for you, that's the thing. I don't know what else to do. And I've had people say, maybe it's something in your diet, maybe too much alcohol, or because I like to eat a lot of cheese as well, cut out that. So I did that and it didn't work. It really is. It's yourself attacking you because of the stress. But I don't know of any other way to sort of deal with it. I guess it's just kind of having to deal with what's happened in my life. But at the end of the day, that pain is still there.
It's something like this though, Rob. I'll ask you here as well, because obviously you're going through a lot of emotional things as well. Have you ever had counselling or anything like that for it, or is it just something you've
because it's still there, isn't it? Do you know what I mean? And there's only so much makeup that you can put on your arms and legs. I mean,
but to deal with the stress, all the stuff that you went through with your dad and everything like that. Because
I haven't.
That's still there. And that's what could be causing making it even worse. I don't know if you agree.
But we also refer people to skin clinics where they see psychologists because of the psychological impact skin conditions have on people, and it helps them to deal with not just the skin condition, but other people's reactions and actually the whole stress of all the treatments. I mean, to be fair, the treatments are effective, but they take a lot of time. It takes a lot of time to put cream on the body and to follow the guidance of the dermatologist.
It doesn't work in 5 minutes.
No, and I remember meeting somebody who has very severe psoriasis who said, well, actually, I don't bother to go out because it takes me 3 hours to get ready with all the treatments. And then I know that a couple of hours later I've got to do the same thing again. So they say, well, actually, I just stay at home because that's my routine. But from a treatment point of view, we also now have a new range of treatments, the biological therapies, which actually adjust how the immune system responds. So I would say to anybody who's got psoriasis, who's gone through the routine treatments, as we call them, and has had the UV treatment as well, if they've not been considered for this sort of treatment, they ought to have a chat with a dermatologist to see whether it's appropriate for them. It may not be, but nothing ventured, nothing gained.
Is that something you could try?
I'm going back to the dermatologist tomorrow,
actually.
Okay,
good. All right.
Back again. And I did a photo shoot for The Sun back in February when I was on your programme the first time, a couple of weeks later. And that story has gone all over the world. And I did a shoot in a bikini for that, to try and get it out there, to say to people...
I saw the pictures, I thought you were so brave to do that.
Oh, I just thought I looked fat and horrible. I was like, oh no.
No, but you did something to raise awareness about something, and I thought it was really brave of you to do that, because not many people would. But the fact is you're raising awareness about it, you're trying to get help for people that are going through it, which I thought was great.
It takes a lot of guts and courage to do that.
Just be nice to actually wear a bikini and not have to worry, just be clear. I don't care about being a bit bloated or putting on a bit of weight anymore. I really don't care. I just want to be clear. That's all. It's not too much.
Well, the good thing is they're still doing research and things, aren't they, Rob? To, like I said, they've got this new range of
therapies are emerging, but I think we mustn't forget the psychological impact and the benefit that psychological therapy can have, even if it's as simple as encouraging somebody not to scratch, because one of the things with psoriasis is you want to scratch, and that tends to make matters worse. And so there are scratch and itch clinics where people can attend with a psychologist to learn how to deal with that moment, to distract themselves from the moment so that they don't cause further damage to the skin. So it's always something, there's always something that can be done.
I've heard that there's an injection that you can be given, but I know that it's very, very expensive. I have actually asked for it. I mean, I think it's like a couple of grand for an injection that you give to yourself after you've gone through all the bits and pieces that I've gone through after the past few years. But that's what I'm going to be asking about.
Ask your dermatologist.
Yeah.
If it's right for you, they will encourage it. But remember that all treatments are not right for everybody, so it doesn't hurt to ask.
Yeah, sure.
Definitely. Guys, thank you, Tony. Thank you so much for coming on and sharing what you're going through.
And thank you.
I really wish all the best for you for the future, because as I said, let's keep positive. There's research being done all the time. You can try this other new stuff that's out now and see what happens. And I want you to keep in touch with us as well.
I'll let you know how it goes.
Yeah, definitely.
Yeah.
All right, so Rob, you're going to stay with us because we're going to be talking about rosacea after this break. And join us, we have Dr. Anton Alexandrov, who is a consultant dermatologist, and we'll also be joined by Sarah Jagger, who has this condition. Hi, I'm Chrissy B, and my show is all about improving your mental health and being happy. Join me every Monday, Wednesday and Friday at 10 p.m. on my channel Sky 203. Visit chrissybshow.tv for more information and subscribe to our YouTube channel, Chrissy B Show. You can also follow us on Twitter and Instagram at Chrissy B Show and on our Facebook page, The Chrissy B Show. Welcome back to the programme, everyone, and we are doing a medical special today. We've covered 2 topics already. Rob, what were they?
Well, we've covered the importance of having a cervical smear test, and we've talked about the long-term skin condition, psoriasis.
Okay, now we're going to be speaking about another skin condition, which is rosacea, and now I have joining me Dr. Anton Alexandrov and also Sarah Jagger. Welcome to the show.
Hi. Thank you.
Lovely to have you here. So, first of all, can we start off with you, Anton? Can you tell us what rosacea is and how it starts?
Rosacea is a very common condition. Unfortunately, 1 in 10 people affected by rosacea. It's usually more common in ladies, about 2-to-1 ratio between ladies and men, and it's probably between 30 and 50 most common, but can affect any age really. It's more common in people with fair skin, but again can affect any race. And it's quite distressing condition because it's either red face, which could be transient, like flushing, or it could be permanent, and also it could be pimples and bumps, what we call pustules and spots. And it could be quite a distressing condition, I'm afraid, because it undermines confidence of patients and causes lots of anxiety, unfortunately.
Okay. Now, obviously, we're going to get to how it's treated and everything, but I'd just like to speak to Sarah first of all, who developed the condition. How old were you when you first
I was
noticed it?
unusually young for rosacea, so I think for me, it was in my teens, and it was something that I was aware of, that I always had red skin. But then when I got older and I started writing about beauty, I was really lucky to be able to have access to dermatologists and got to know what it was pretty early on. So I've always been aware of it and aware of the triggers, which have been really helpful.
Okay. So what are the triggers for you?
For me, it's things like wine, it can be hot drinks, central heating in areas where there's not much oxygen, so things like airports, aeroplanes, where you're not getting a lot of fresh air. Stress can also be a bit of a trigger. Coming in and out of the cold, so winter it tends to kind of be a little bit exacerbated. But I think really, I am very lucky in that I've always had the milder form of rosacea. Some days it's really horrible, but then some days like today it's not there at all. Whereas as a makeup artist, I have so many clients who suffer from it really, really badly. And being in front of the camera, it's affected their confidence hugely. So for me, it's always been about looking at the ways to cover it up. And once I mastered that, I realized that, and meeting Anton, it was such a revelation to discover that there's treatment there. It's on the NHS, it's at our local GP, and can take it away instantly.
Okay, can you tell us about the actual treatments, Anton?
There are different treatments. There is treatment for spots and bumps, and this is antibiotic or non-antibiotic preparations, oral or creams. But the breakthrough was the recent treatment for redness, for permanent redness or flushing transient redness, and this is a really good treatment. The reason rosacea happens is because there is abnormal excessive flow of blood to the skin, and what this treatment does, on the days you apply it, it controls it and helps minimize the redness. Okay. So it's a bit of magic, I guess.
Now, you were saying to me earlier as well, Sarah, that a lot of people don't actually realise they have it in the first place, but you can obviously spot it as a makeup artist. Have you ever had to say to one of your clients, oh, you know, maybe you should get this checked out, or generally do they know that they have it?
All the time. And
really?
I'm not a doctor, so I've got to be a little bit careful what I say, but I can say to people, go to your doctor. Because so many people, especially if you can imagine that you're in the public eye, you're really well known and you want to appear confident, and yet your makeup is sliding off down your face, the redness is showing through, you look like you're really embarrassed, you look like you're really nervous. It's the worst thing that you could go through when you're in that kind of situation. So yeah, I can always recommend dermatologists, and now I can say to people, just go to your GP. But I think I've got some great products in my kit that I know can help to kind of counteract the redness, tone it down, help makeup stay on a little bit longer. So there's so much help. And it's, if you do think that you have red skin, you can treat it. You don't have to put up with it and think, oh well, I just have red skin, like a lot of people.
Now, when you said, because sometimes you said it can be bad, but obviously not as bad as some people that have it in a more serious condition. But when you first started to sort of feel that, and like it was quite bad for you, how did you pull yourself out of that and try to keep positive about things?
I think for me it was always, you know, I'm really lucky that I've been brought up by a family who are really great when it comes to helping me, raise me with self-esteem. So I'm really, really lucky there. I think that the what's inside that counts stuff has kind of seen me through my life pretty well.
Because it's true.
But redness, you know, in school we weren't allowed to wear makeup. So I would sneak it in because I just felt it did give me that little bit of confidence, and I think it's probably contributed to wanting to become a makeup artist, because I knew that I could help myself. I could do it in a way that was very subtle and no one noticed.
And now you're a celeb makeup artist.
Well, yeah, and it helped my confidence so much, and then I could sort of do that for other people.
Oh, that's really nice. Now, Rob, let's get your take on this as well, because you said something quite interesting in the intro that you know, some people think that someone's just been drinking a lot, and that obviously impacts their self-esteem.
Yes, I mean, it's following on from what Sarah was saying, is a lot of people think, oh, I've just got red skin, and that's me. Other people will say, oh, you always seem to be embarrassed all the time. Why are you blushing all the time? And then other people...
but some people don't say like that, do they? Say, oh, hi, you're red.
Well,
and
absolutely. You get the teasing and you get the taunting. But also people say, oh, I know that person with it. They must be a drinker. And for some,
did you ever get that?
Well, actually, when we were a kid, I'm sorry to interrupt you. When I was a kid, we had a person just down the road who we all used to say, oh, you know him, he really likes a bit of a drink. And actually, he was a guy who probably just had rosacea. We probably judged him incorrectly.
So I think, you know, it's important that if your skin is causing you a problem, either because of the way it's affecting you physically or emotionally, then go along and ask your doctor, is there something that can be done about this, rather than just suffering? Because with all skin conditions, there's a huge psychological component. You know, people feel that they're losing their confidence, they're losing their self-esteem, they're becoming more stressed, and you get into this vicious cycle. Well, that's likely to trigger further flare-ups of the condition. And with rosacea, one of the things you can do is try and identify your triggers, as you did. You know, keep a symptom diary. Think, and then you're in a position where you can avoid them. as best you can, in addition to the treatment.
Because you can't stop, drinking tea and coffee and then go outside. but yes, minimize it, and then on top of it, if necessary, use treatment.
Yeah. I mean, I had a patient years ago who it was spicy foods that set her rosacea off, and she said actually with the balance, she said, right, I won't have spicy foods because I'd rather have clear skin than than curry, etc. But as you say, Anthony, you don't have to make that sacrifice.
Absolutely.
But some people will choose to do that.
Okay, so always the first port of call is GP, and then the GP will refer to a dermatologist like us.
I think so. I mean, in general practice, there are a number of treatments we're able to prescribe, so it doesn't necessarily mean having to refer somebody to a dermatologist. But if we're not sure about the diagnosis, or maybe the person's tried these treatments and it's not controlling it as well as we would like it to, then yes, we'll seek the advice of our specialist colleagues.
Yeah, absolutely.
Okay. And in terms of any research, Anton, can you tell us any progress that's happening with this condition? Anything new?
Huge progress for last 2 years. So this treatment for the red skin only became available 1 or 2 years ago. So in the past, we really couldn't do much. It wasn't much point to refer to dermatologists. Now we have this fantastic treatment. And when the latest breakthrough, I guess, is that we have a non-antibiotic cream for the pimples and spots, which is more effective than antibiotic cream. You have no problem with antibiotic resistance. So, all this about new antibiotics and don't use antibiotics, so it's all coming through.
Brilliant. And so just final words from you as well, for maybe for some of the younger ladies that are watching, or any age. But obviously it affects men as well, doesn't it? But for the people that are watching that are feeling a bit unconfident, feeling a bit low because they've now discovered that they have this condition and it's like, oh no, it's going to change my life. What would you say to them?
I would say it's treatable. This is something that there's a topical gel that you can now get from your GP, which literally instantly takes the redness away. There's so many makeup videos online that you can watch. There's so much information out there that you can get to do really subtle coverage that doesn't have to mean caking yourself in makeup like it used to a long time ago.
That's a worry that a lot of people have, like, now I'm going to have to cake myself in makeup, but
it's not necessary. Cosmetics are so good now. We don't need to be wearing heavy makeup to cover anything. But I think really it's about being open about it. The one thing that I think that is so important is that everybody who has rosacea should talk about it, because then we will all know that it's a normal thing and we won't judge people as much, and we'll just basically have more compassion for each other.
Yeah. Which is exactly the reason why we're doing this show today, isn't it, Rob?
Absolutely right.
All right, thank you so much for your contribution to today's programme. It's been really helpful. Thank you. Rob, you're not going away, are you?
No, I'm stuck.
Why? What are we talking about after the break?
We're going to be talking about another important subject, heart disease.
Heart disease. Okay, guys, so don't go away. Hi, I'm Chrissy B, and my show is all about improving your mental health and being happy. Join me every Monday, Wednesday and Friday at 10 p.m. on my channel Sky 203. Visit chrissybshow.tv for more information and subscribe to our YouTube channel, Chrissy B Show. You can also follow us on Twitter and Instagram at Chrissy B Show, and on our Facebook page, The Chrissy B Show. Welcome back to our medical special, everyone. And actually, we've covered already 3 topics. We're going to be covering 1 more. But if you have missed the beginning of this program, or the first 3 parts rather, you can head over to our YouTube channel in a few days' time, Chrissy B Show, and watch everything there. It's been very, very important. And don't forget to subscribe while you're there. So, Rob, three areas that we've covered so far: cervical screening, the psoriasis, and rosacea. All been really interesting and really useful, hasn't it?
Very, very interesting, very useful. I've learned something from each of the, our guests that have come in. With regards to cervical screening, I wasn't aware that how many women haven't had a cervical smear test.
So shocking.
And who delay.
So shocking, yeah.
And I think it's important that women know that it's not just important, obviously, for detecting abnormalities that can be treated before these abnormal cells can develop into cervical cancer. But also that there are different ways of getting tested in different places. And that you can take a friend with you. you can go and have a chat with the practice nurse or the doctor beforehand to get an idea about what's going to happen, you know, particularly if it's your first time.
Yeah.
And as I mentioned, take whatever works for you to distract you. It might be the
I've never heard about the phone before. That was quite good.
It's one of the few...
We just tweet out while I'm having a smear test.
It's one of the few times when we're more than happy to have people, you know, playing with their smartphones, playing with their tablets. Because, of course, if that's what relaxes them and distracts them from what's going on, then that's a benefit.
Why not?
Yeah, why not?
And Sonia was very, very brave, wasn't she, about
brilliant. Such courage.
Yeah.
Real courage. And I think, you know, it should give a lot of people with psoriasis the confidence, really. One thing that I know from practice is that if in the heat of the summer I see a patient who is covered up, you know, men in a three-piece suit, for example, there's a really good chance they've got psoriasis because they don't want to uncover their skin. They don't want to show their skin.
It's not funny one to say, why is that person wearing all those clothes in this heat? Because you do say that, don't you?
Yes, and they're happier to have that, that sort of comment than they are to have people, as she said, staring at the skin. So, you know, lots of very good support there, I think. And from a rosacea point of view, as Anton said, you know, the dermatologist said, there are new treatments around all the time.
Yeah.
And it's not a case of you just have to live with it. This is a situation where you may have a red face, and that is you. However, you may have a red face and it's flushed because of rosacea. And you may have a red face and you're quite happy to live with it. But if you have a red face and it's causing you problems, physically or emotionally, then go and get it treated.
Yeah, definitely. So we're going to be speaking now about heart disease, but just before that, Rob, we do have some exercise tips from Jane and Elia, and they're talking about common fitness mistakes that men make and also that women make. So obviously exercise is very important for all sorts of things, Rob, as we've discussed many a time on this programme. So let's take a look at this and then we'll be back to talk more.
Hi, I'm Jane. Welcome to our fitness tips for the week, and I'm with Elia, celebrity personal trainer. So it's lovely to have you with us again, Elia. Today we wanted to share with you our experiences of working with lots and lots of clients, and in our opinion, what makes people succeed and sadly what makes people fail. And I tend to work more with women, and Elia works with a lot of the guys. So in my experience, one of the things that I think the mistake that women make is that they search for shortcuts, they search for fads, and they search for cheats, and it's a road to nowhere. And I think if you can realise that there are no shortcuts, there aren't any cheats that work in the long term. Some of them work in the short term, don't they? But they don't work in the long term. If you can have that mindset at the beginning of your journey into fitness and strength and well-being, you're far more likely to succeed. Do you agree with that, Elia?
Yeah, and also I find with guys, they start to train with me, but they want to kind of go full out, full leather, like with heavy weights. Then they ache for 2 to 3 weeks, and then they lose a demotivation to come back. So I think just kind of progress your training with the weights, speak to a gym instructor, and they can help you in the gym, and just build slowly, because then you can sustain this for longer, because we're trying to make sure it's a lifestyle change and not just some quick fix. So I would just say speak to some guys in the gym, they can help you, gym instructors, and slowly just build your weights up and you'll get there.
I agree with that, and I think set realistic goals, you know, set goals that you're going to achieve. Don't say I'm going to lose a stone in a month, because you're just setting yourself up to fail. So set realistic goals, believe that you can do it. I think a lot of women I know lack self-esteem and self-belief. Try and believe in yourself, believe that you can do it, and put in your diary what you're going to do. If you're going for a walk with a friend or you're going to the gym, put it in your diary and make it something very real in your life, not just some general thing in your head that you're planning to do at some point. Put it in your diary and make the logistics work for you, and believe in yourself, and you'll definitely get there.
Good, guys. So I hope we take some tips on from that, and we'll look forward to seeing you soon.
Thank you very much, Jane and Ilya. So now it's time to talk about our fourth topic for today, which is heart disease. So can you tell us, Rob, what is it and how does it develop? And everything you know about it.
Well, I'll tell you, I mean, it's interesting because heart disease covers, you know, all the different conditions that affect the heart. But nowadays, when somebody's talking about heart disease, what they're talking about is a specific type, and it's coronary heart disease or ischemic heart disease. This is the disease that causes heart attacks.
Right.
And tragically, this is a very, very common disease. It kills round about 1 in 6 men in the UK, and it kills round about 1 in 10 women in the UK. And in a total, over 73,000 people die per year in the UK as a consequence of this condition. So it is incredibly common, and what people don't recognise, or they're increasingly learning, is that women can be affected too. So up until the menopause, men are more affected than women. After the menopause, the numbers even out. And,
why is that after the
That's
menopause?
because to a great degree before the menopause, women have estrogen hormone that protects their heart and circulation. But once the menopause arrives, and they go through the menopause, the estrogen is much less, it stops being produced in such quantities, and so their risk increases.
Okay.
Now, what you might say, well, what is heart disease? What's going on? And essentially, it's furring up of the arteries. It's narrowing of the arteries. If you think about the heart as being, it's a muscular pump. It's about the size of my fist, and its job is just to pump blood around the body, full of oxygen, full of the nutrients that all the organs need. That's what it does. But it's an organ too, and it needs a blood supply. It needs oxygen. It needs nutrients. So if it's not getting enough, because these arteries are furred up, they're narrowed, then you get angina chest pain, you know, that sort of crushing, tight band chest pain. If one of the arteries that's providing blood to the heart, these are called the coronary arteries. If it gets one of them or more gets completely blocked, part of the heart isn't getting the oxygen, and that's why you get a heart attack. And so it's this fatty, yucky, gooey material. It's called atheroma. There's fatty deposits that develop on the inside of the arteries, making them far narrower than they should be, and that impedes the blood flow, and that's, you know, ischemic heart disease.
So what prevention methods?
Yeah,
first
what can
of
we
all?
do? That's the most important, isn't it? Well, you're at greater risk as we get older. You're at greater risk if there's a family history of this condition. Can't change those. We can't stop ourselves getting older. We can't change the fact that somebody in the family has got heart disease. But what we can do is we can get rid of risk factors like being overweight.
It's a classic one, isn't it, for everything?
Yeah, I could ask you. You could tell me the answers to these. Smoking. Yeah. High blood pressure, high cholesterol, diabetes. All these things contribute to damage in the arteries. So those are the risk factors that we can change.
Yeah.
And that's what we advise people to do to avoid this condition in the first place. And we also advise people who've got this condition to do. So we want them to eat a healthy diet, specifically one that's low in fat, you know, low in saturated fat, the fats that we get from animal products and meats, you know, dairy products and meats. We want them to reduce their salt intake, because too much salt puts the blood pressure up, high blood pressure damages the arteries. We want them to keep at a healthy weight, because for type 2 diabetes, being overweight is the major risk factor. We also want them to relax and unwind.
This is a big one, isn't it?
This is the big one.
People
because,
don't relax.
you know, there is...
She says. I do.
It may be that there's a direct correlation, or it may be that when we're stressed, we simply don't exercise and we eat comfort foods. We're more likely to drink alcohol. People are more likely to smoke. And so when people are stressed, they turn to what we call the unhealthy lifestyle behaviours. So as you know, it's not rocket science. Preventing heart disease is not rocket science, but it takes discipline, and it takes willpower as well. And sadly, it's often only after somebody's had a heart attack that they say, right,
now I've got to change.
Now I've got to change. Why wait? Change now.
Because you just never think it's going to ever happen to you or someone in your family, even though a lot of people know the risk factors, but it just, like you said, it just takes something serious
You're
to
right.
happen.
I think that's the philosophy.
Yeah.
The philosophy is it's not going to happen to me. Particularly in younger people who say, oh, well, if it happens, it'll be 40 years, 50 years' time.
Yeah.
But actually the damage is happening. We come across people who are having heart attacks in their 30s.
Wow. That's crazy.
So there is good news. I mean, it sounds doom and gloom, but there is good news because there's lots of things people can do. Simple activity, healthy diet, give up the cigarettes, keep alcohol to within the safe recommended amounts, take the time out to relax, enjoy yourself.
Is it reversible in the sense of if someone already has heart disease and it's quite bad, it's quite serious? What can they do, first of all, with medication and other
Yeah, well,
things?
for people who are at risk and who've already had a heart attack, lots of medication around. So aspirin, for example, to lessen the likelihood of further clots developing and further blocking off of the artery causing a heart attack. Cholesterol-lowering drugs. If somebody's got diabetes and you're treating that. Treatments to help people give up smoking, for example. Lots of medicines available. Other medicines that will help the heart perform well. Other medicines that will help lower blood pressure that's too high. And then, of course, there are surgical procedures. So we can now, well, I say we, I mean cardiologists and surgical specialists can now open up those narrowed arteries with a procedure called angioplasty. So basically you put a balloon into the narrow bit. You pump up the balloon, and that opens up the artery.
Yeah, wow.
And sometimes you leave a little sort of metal mesh in there called a stent, which keeps it open and allows the blood to keep flowing through. And you may have heard of an operation called a cabbage, which is CABG. It's a coronary artery bypass graft. You essentially take another blood vessel and you sew it around a blockage to bypass the blockage. So there are these things that can happen for people as well.
But prevention is always better than cure.
Prevention's much better than cure, and it's more fun.
Okay. So guys, unfortunately we have reached the end of today's programme, but for me it's been so educational. Rob, thank you so much for coming on today to talk about all of these subjects, and I'm sure we are going to do more medical specials soon, aren't we?
I hope so.
Yeah. And the key thing is, please, don't suffer in silence. There is help out there available, not only from your GP, but there's other avenues that people can take as well to, specialists and all sorts that you can try.
Yes.
And obviously we don't want, as we said at the beginning, we don't want the medical conditions that you may be going through to affect your mental health, because then you've got another issue to deal with. So always best to get things, see to things as soon as possible, because you are valuable and you do deserve the best out of life. Thank you, Rob.
Thank you.
All right, guys, so we have, as I said, we have reached the end of today's programme, but if you have a topic that you would like to see discussed on this programme, this is your show too. Do get in touch with us via the website, chrissybshow.tv. You can also tweet us at Chrissy B Show or leave a message on our Facebook page, The Chrissy B Show. And also, if it's maybe something that you yourself are going through and you'd like to appear on the programme and get some help on the show, do get in touch with us too. Until next time, bye-bye for now.
Love being on the show today. I think it's really important for us to talk about issues like rosacea and skin conditions so we can relate to each other, so we can know that help is at hand, we can support each other. Rosacea is something that you can go and see your GP about. You can get help really, really quickly and you don't have to suffer with it.
Thank you very much. I'm delighted to come and help with raising awareness about this very common and unfortunately distressing condition. One thing which I didn't mention during the show, the patients who were probably most distressed in my practice are, of course, ladies, but also men, because men can't put makeup on, and really for them we need medical treatment, and it can be very distressing for them and undermine their confidence and make them very anxious. So thank you for inviting me.
Enjoyed it, but it's not really about my experience. It's about trying to get women to engage and having their smear test. Tonight's not about me. It's about just getting women through the door, have the smear test, hopefully save your life and don't get cervical cancer. So it's not about me, it's about the women.
I really enjoyed it. Thank you very much. I found it awesome to be able to share my experience, and I really hope it has prompted other women out there who do need to get their smear test done to go and book an appointment.
I had a great time actually. It's just to actually get this out there, and if anybody gets a little itch or something like that, you've got to go straight to the doctors. You don't want to end up how I did or how it's getting again, and I really appreciate you inviting me on again. Thank you. I hope this helps people.
How's that?
That's better. and it's not a... Oh, shut up, we start again. Sorry. Sorry. And of course we'll have you on, Rob, throughout... Sorry. Oh man, sorry. We also have consultant dermatologist... Advising the ladies out there all about... That wasn't our fault. Is he almost... Oh, we have to do it from the beginning.
Yes.
No, that was going so well.
It's going so well.
I have no idea what I'm going to ask you. We'll just have a chat.
Yeah, we'll have a chat.
I forgot to put your questions in. So I'll just say over to you, Rob. Welcome back to our medical special today. And so far we've covered... Hang on. I forgot the first one. I'll ask you what we've covered.
Yeah.